Meet Karen. She's just an ordinary, middle-aged suburban mom in search of a manager. Why, you ask? Because she's desperately in need of some toilet paper.
Now, you're probably wondering, what does any of this have to do with science? Well, we're living in a time of COVID, and that sometimes means that basic necessities are often out of reach. But this isn't the first time that a disease has taken over the minds of people all around the world. Flashback to the Ebola epidemic from 2014, the disease of our childhoods. Now, you're probably wondering, what makes Ebola so much different from COVID-19? Well, let's find out. First, let's break down what COVID-19 is. COVID-19 is infectious respiratory illness caused by the new strain of coronavirus. It surfaced in December of 2019 in the Wuhan province of mainland China and was spread to humans via zoonosis, which is any disease that is naturally transmissible between animals and humans. The name of the coronavirus family refers to the crown shape of the virus. These viruses cause respiratory illnesses, and their symptoms can range from mild to extremely severe.
Now that we know a little bit more about the coronavirus, let's take a look at a cousin of hers, Ebola, classified under the genus Ebola virus. Originating in Africa, fruit bats are thought to be the original host of the virus, similar to COVID-19, which was spread through zoonosis. During the 2014 outbreak, Ebola was calculated to have a 90% fatality rate. The first case of Ebola was reported to be around December of 2013 in a young boy from Guinea. From then, it spread around the world, becoming an infamous epidemic. Now that we know a little bit more about the background of these two viruses, let's compare them.
When looking at COVID-19, we have a wide breadth of countries to analyze for how they manage the virus. The virus has taken over the world. But for the sake of this video, we'll just focus on two countries in particular, South Korea and the United States. South Korea is often cited as the example country for their management of the coronavirus. Their response began immediately after their first case in January 2020. They also quickly set up diagnostic testing, which was easily accessible to their citizens. While the situation with the virus continued to develop, they were completely transparent and provided real-time and frequent updates. There was also a unified public-private sector response, and the country organized as a national effort. Social distancing measures were also implemented, and these involved quarantining those who had the virus in select facilities, given that they'd had such a successful run with diagnostic testing. This can largely be attributed to their experience with the MERS outbreak in 2015. Their experiences here helped South Korea respond faster and more effectively to the virus. The US, on the other hand, was slow to respond to the virus. They initially enacted travel restrictions as well as screenings for those coming in and out of mainland China. However, their distribution of testing and overall nationwide response was a lot slower than South Korea's. Testing was also not widely accessible, and the US was not ready to meet the demand for testing. The US was also not as transparent about the potential threat of the virus, as the government was quick to assure that the virus was going away despite spiking numbers in cases. The wider response was also not unified, as local government response varied from state to state and even county to county. The executive branch of the government, in cooperation with the CDC, released their social distancing guidelines for America, titled 30 Days to Slow the Spread, which was successful for a couple of weeks. However, reopening efforts before the virus had subsided have caused a drastic increase in cases.
When dealing with the Ebola outbreak in 2014, the United States worked hard to isolate patients coming back from West Africa. Advanced screening was implemented at airports, and pedestrian cases were drastically limited compared to the current COVID-19 outbreak. In fact, most of the U.S. cases consisted of infected healthcare workers aiding the recovery efforts in West Africa. Speaking of West Africa, countries in this region got off to a bit of a rocky start. Lack of prevention during the early stages of this disease led to its spread into many urban areas. The density of the population in these cities only spread up its rate of transmission. However, with help from other countries, those in West Africa were able to implement preventative measures at borders and other new policies to help slow down this spread. Even if Karen never gets her toilet paper, at least she'll sleep soundly knowing that there will be a day in the future where she can go out without having to wear a mask and have it not be so controversial.